and take it away.
Yes. Hi. Okay, good. It works. Great. Hi. Thanks for coming back from break. My name is Gretchen Unger. I'm the Chief Scientific Officer for Rovermed Biosciences. Rovermed is a new opportunity in nucleic acid drug delivery. So with the advent of gene editing and the renewed interest in genetic therapies, Rovermed is poised to capitalize on this opportunity with our 20 nanometer cell specifically targeted nanoparticle platform we call CUSP, or crystalline ultra small particle. So what's important, there we go. What's that thing? Yeah, okay. So what's important about CUSP is that it combines the best features of viral and non-viral delivery to create a new entity that is not only very small and can carry large payloads, but is non-inflammatory.
Sorry, Gretchen. We're going to drop you just a little bit so we can hear you better.
Okay, good. So what's important is that the CUSP particle is non-inflammatory and has a straightforward, scalable synthesis. And so to basically to hone in on that point a little bit more, what we've really got then is essentially what we've got is a non-inflammatory virus that has dialed-in tropism, and this is a very important source of pharmaceutical innovation. And frankly, this is the paradigm shift we've been waiting for to make nucleic acid therapies available to everyone. So we're targeting all kinds of macromolecules, including CRISPR, RNAi, and antibodies. Our business strategy is to partner with drug developers for non-dilutive funding and downstream royalties. And to validate this model, we already have 3 signed evaluation agreements. 2 are in CRISPR, 1 is in RNAi, and we're in discussion with several other parties. So to summarize what this opportunity is, after 18 years of research and development, we have a proprietary partner-ready drug delivery platform, and it's highly differentiated, applies across multiple therapeutic markets, and it's organized as a lower-risk partnering model and as an LLC with secondary endpoints of IPO or some kind of acquisition. And to just conclude, the specifics of the raise are, as we're asking for an initial $500,000 at $1.15 per share, and this will be funding some of the infrastructure, equipment, personnel, and most importantly, patent support to achieve the milestones that we're expecting to get to our first value inflection in mid-2017 with a first R&D licensing deal. So with that, I will take questions. And thank you for me.
So you mentioned CRISPRs were one of your target technologies. What diseases are you trying to treat? Do you target that way?
We're doing third-party formulation. So the question is what? So we're working for the drug developer. So yes, we're yes. So we do whatever they want. I mean, but we have delivery systems that are already geared for. We can do liver, we can do muscle, we can do particular blood vessels in the liver, we can do skin, we cross the blood-brain barrier, we do tumors, we do all kinds of. I mean, just goes on and on. So there's eye's a big one. That's real popular.
Have you thought about also selling to the research market at all?
Yes, we have. And we're trying to think of ways to make that work. And yes, we're trying to think of ways to make that work. But yes, right. Any other questions?
The advantages of the CUSP, these crystallized nanoparticles, versus, for instance, liposomes where you could just...
Okay, so and that's so the nanocapsule is very small. It's 20 nanometers. It's not going to get stuck in the liver, so it'll go all the way around the body. As I mentioned, crosses the blood-brain barrier. And the critically important thing is because of the unique size, we're actually engaging a novel cellular uptake pathway which avoids the endosomes. And so that bursting of the endosomes, which is what virus and liposomes do, is a major inflammatory signal, and that really leads to much of the toxicity and also the problem of antibody development. So with the nanocapsule, you've got basically a very small virus that can be readily redosed. So we can repeat dose with the nanocapsule as well as dial in exactly where it's going to go.